The Cabinet for Health and Family Services has now released its plan to reopen childcare in Kentucky. You can find the plan by going to the Kentucky COVID website at kycovid19.ky.gov. If you scroll down to the Healthy at Work site, click on it, and then below that there are dates of when different businesses are reopening. You can go to June 8th or June 15th to click on the plan to reopen childcare. Family childcare homes will be reopening on June 8th, and center-based childcare will reopen on June 15th. There are several frequently asked questions that we have received at the Division of Child Care, so I would like to give you some information on that now. First of all, in the plan to reopen, we asked for the reduction of adults that spend time with the children that will be in the centers by having consistent staffing with the children at all times. Let me clarify this. We understand that teachers will need lunch breaks, that there will be days when they have a day off due to vacation time or illness. We are asking you to reduce those changes as much as possible based on your staffing. Primary teachers should be in the same classroom all day. Assistant teachers should be with the fewest amount of classrooms as possible. Floating teachers that do lunch breaks or support in the classroom should limit themselves to the fewest amount of classrooms as possible to make sure that exposure is reduced. Again, we understand that the same teachers will not be able to be in the classroom with the same group of children from open to close. Please use your best judgment to reduce the number of staffing that are exposed to each group of 10 children. We have also had a lot of questions about using temporary walls to divide spaces in classroom. There are several requirements that must be in place to use temporary walls. The temporary walls must be at least 6 feet tall. You cannot use furniture like shelves that are just rearranged in the middle of the room to divide the space. The temporary walls must be stable so that they cannot be pulled down on top of a child. Even with the temporary wall in place, there must still be 35 square feet of space per child in the room. Divided classrooms are allowed to share a bathroom. Just make sure that increased cleaning happens based on the number of children that will use the restroom during the day. And finally, the new traffic pattern with the temporary wall in place would still need to follow the guidelines for opening centers during the state of emergency. Other questions that we have had regard childcare training hours. There is going to be a new mandatory training that all childcare staff members will have to take before centers reopen. If you're a family childcare home provider, you will need to take it before June 8th. If you work in a childcare center, you will need to take the training before June 15th. This is a short training that will go over all of the health and safety requirements that were in place prior to the COVID-19 pandemic and new increased health and safety precautions that we are adding due to the pandemic. It will also cover content on mandatory reporting. This training will be available free on the UKHDI website beginning on June 1st. Again, all staff members in your facility will need to take this training prior to reopen, and all staff members that are hired within the first 90 days after your center has reopened will also need to take the training at this time. There is a full sheet of frequently asked questions that has been distributed by the Division of Child Care. It was sent out to child care providers this week. Please make sure to review the list of frequently asked questions to make sure that your questions are answered. However, if you have a question that was not identified on the frequently asked questions list, you can reach out to the Division of Child Care or the Division of Regulated Child Care to assist with any of your questions. There will be emergency regulations filed for these new enhanced requirements to reopen child care programs. Those regulations will be going up soon, and we will notify the child care community as soon as they are out. Thank you again for all of your hard work to make sure that our Kentucky children stay healthy and safe. Have a good day.